There are dozens, if not hundreds, of hip stretches out there if you're trying to improve your overall hip mobility. But in this video, I want to explore, is there one that is the most bang for your buck? Let's talk about it. What's up, guys? My name is Dr. Brian Larish, and I'm the owner of Performance Redefined, a cash-based PT clinic, as well as the creator of the PT Growth Academy, where we strive to raise the standard of physical therapy. Now, in this video, we are asking the question, what is the biggest bang for our buck hip stretch? Is there one? And so at the end of this video, you are going to learn one exercise that, in my opinion, has done the most good, has provided the most value for all of my patients that I've been working with for the past 13 plus years. So let's jump into it and discuss the biggest bang for our buck hip stretch. So the first thing we need to define is, what is bang for our buck? Well, to me, it's ultimately what has provided the most amount of value over a long course of time. And so what I'm sharing are common themes that I have found over the past 13 years of working with people when it comes to how they feel and their actual hip mobility. Now, bang for your buck to me as well is, what is the easiest thing we can do that has the greatest impact or biggest outcome? The easiest way that I like to think of it is a house. If you think of a foundation, a first floor, and a second floor. If you have a second floor problem on the house, but it's not truly a second floor problem, but you just fix the second floor, usually you'll get it to go away and then it comes back, and then you have to fix the second floor again, and then usually it comes back and you have to fix. So you're doing this constant fix, it's good for a little bit, and then fix. Well, if it was actually a foundational problem under the ground because the house is leaning, that second floor problem is never truly going to be solved because it's not actually a second floor problem. It's a foundational problem. So if and when you go and fix the foundation, the second floor problem magically goes away. This is how I like to view a hip mobility or a hip stretch. In other words, I want to attack the foundation and not get caught up in the first and second floor. Sure, you may feel a first or second floor problem, tightness, but if you can focus on the foundation, it tends to work the first and second floor out. And when it comes to the foundation of the human body, the pelvis is what I'm referencing. And the first floor being the legs, the second floor being the arms. So with that framework, that's how we're thinking of bang for our buck exercise as we move forward in the video. So now we understand that this guy is the foundation. So when we think about a stretch that's going to give the most bang for our buck, we want to incorporate and focus more here compared to focusing here. Notice how a lot of the common stretches tends to focus the leg. And I'm going to kind of talk about why that's not always the best option. So besides the foundation, we also need to be aware that in most human beings, there's some sort of asymmetry. And so we have this right side turn or left side turn. It's normally more to the right, but you can definitely still have to the left. Now, just consider this. If we are turned to the right and I just stretch my leg, is it changing anything at the foundation? No. If anything, it's getting us more mobile in a dysfunctional pattern. If we were going to do a stretch, we at least would want to be neutral, right? And I can explain this one step further. And go ahead and stand up with me. As you stand, hip shift to the right, hold on to something if you need to, and do a straight leg raise on the left, stay shifted to the right, and do a straight leg raise with the right. Hopefully with me, you notice that the right side went up higher compared to the left. Now, a lot of us would call this side tight. Is it really? Let's see. If we shift to the right, we do a straight leg raise on the right, stay shifted to the left, and we now have more motion. So it wasn't really tight. What's happening here? The position of the pelvis dictates the mobility of the legs. In other words, the foundation determines how the first floor sits. So if we have someone that has an asymmetry and we're just stretching, is that really the biggest bang for your buck? One, it's focusing not on the foundation, and two, it's not going to yield the biggest outcome because they are going to stay in this pattern and still probably run into the same problem day in and day out because the source was never addressed. So hopefully that kind of paints a picture as it relates to the human body and our overall foundation of the house. Now, when we're in this pattern, what happens from a height perspective is we usually get really compressed in the posterior outlet on one side. And what this does from a functional performance standpoint is it makes it really hard to rotate. Usually people can rotate on one side and struggle to rotate on the other. And so if they can't rotate here because muscles are compressed, then they can laterally bend, they can extend through the spine. There's different things that they can do. But the point being is that when they're in this pattern, one side is going to be harder to rotate on. Now, go back to our biggest bang for our buck. How do we define that? The thing or the stretch, the mobility drill that's going to yield the biggest outcome. What is something that every single person does, whether they're an athlete or not? Walk. So, what this boils down to is that the biggest bang for our buck hip mobility stretch is going to focus on the foundation to improve rotational capacity. I have found over the past 13 plus years of working with individuals that when we can restore rotation because the posterior outlet has expanded and opened up, it has yielded the best outcomes. This is outcomes related to pain, performance, general movement, mobility. So, with that being said, and that frame of mind, now I want to show you a very easy, I know it seems like a lot because I've worked and built this up, a very simple bang for your buck stretch. What's better than a bang for your buck stretch is one that's really easy to coach and perform. So let's jump on the ground and walk you through the biggest bang for your buck hip stretch. All right, welcome to the ground where we now have a foam roller. We're going to use a foam roller for our biggest bang for our buck stretch, but we are definitely not going to be foam rolling. The goal here is to open up a posterior outlet that is locked. Like I said, it's a very simple exercise, but it goes a long ways. And in general, patients really feel it. They feel that stretch, they feel that burn. Here are the very easy steps to follow. What you're gonna do is place one knee on the foam roller, specifically on the edge. Definitely don't wanna go too far in the middle, right on the edge. Step number 2, bring the other knee so it's slightly in front of the foam roller knee, and it can be off the ground at this point. Step number 3, get long with the arms. And then from here, just pretend that you're a piston and that right knee can only go straight down and straight up. And what you should feel is every time you push down and go towards the ground, you should feel a nice left posterior hip stretch. That's it. That is the biggest bang for your buck hip mobility. What you're going to find is that in general, most people feel one side more than the other. This is often the side that's more compressed and locked up. This is also the side that they're normally turned away from. And so what you should do is once you do the left leg, go to the right leg, whichever one they felt more, at least do 1 to 2 more rounds. Really get them rotating the pelvis. And once they've got through a couple rounds, check their range of motion. You should see increases in range of motion, as well as go into your exercises. They should feel better. Usually they walk away kind of feeling that area. It should feel different because it's not used to being that expanded and opened and not compressed. So there you have it. That is the biggest bang for your buck exercise. Like I said, it's simple, but sometimes the simplest things in life are the best things. And not to mention the 13 plus years that I have seen this mobility drill work wonders. Now, if you don't have a foam roller, just throw their leg up on a pad, an Eric's pad, a bench. You can do this any way you want. The foam roller is great because it's a stable surface, but the most important aspect are the principles. The principles of rotation to open up the posterior outlet. So give this a shot and let me know in the comments below, A, if you have any questions, and B, how you feel after you do it.